Welcome back now to some health matters. Nangombe, Executive Director of the Ministry of Health and Social Services, emphasized the critical need for prioritizing the health and safety of mine workers during the recent signing of Mine Health and Safety Standards Operating Procedures. This collaboration between multiple ministries aims to enhance safety protocols in the mining sector, which is vital for protecting workers in a high-risk environment. Mr. Nangombe now joins us on the line, or rather via Zoom, from Swakopmund. Mr. Nangombe, good evening and thank you so much for joining us.
Good evening, Nina. How are you this evening?
I am good. How are you, sir?
I'm very well. Thank you very much for reaching out.
Mr. Nangombe, talk to us to start off with about, the specific health and safety challenges that mine workers in Namibia face.
Yeah, basically, the mining industry can be quite hazardous in terms of people who are working in that environment being susceptible to infections due to, for example, the dusty environment, the confined spaces in which they work. Therefore, the mining industry or the mining activities producing dust and silica dust and other such material where people who are working in there can pick up infections such as TB. And then we know that where a person is infected with TB, they are also susceptible to infection with other diseases such as HIV and or occupational lung diseases. So in order to address that problem, the government offices, ministries and agencies, namely the Ministry of Health and Social Services, the Ministry of Labor, Industrial Relations and Employment Creation, and the Ministry of Mines and Energy came together in order to produce standard operating procedures that are going to be used by the mining industry, also by the offices, ministries and agencies in line with our mandates, where we are responsible for regulating certain aspects related to issues of labor, related to the issues of the provision of healthcare services for people affected by these conditions, and of course for the Ministry of Mines and Energy as a custodian of mining activities to engage the industry in order to ensure that our people are protected. That is why we developed these standard operating procedures, and this is what we signed together as executive directors of the three ministries. I just want to add that the standard operating procedures were actually initially developed by the Eastern, Central, and Southern Africa community, which received funding from the Global Fund in order to address issues related to TB in the mining sector. And we then took these generic standard operating procedures, we domesticated them so that they fit the Namibia country context, and that is where, given the burden of TB in the country, we wanted to put in place mechanisms that can allow us to address this problem.
Mr. Nangombe, can you elaborate for us on the, elaborate on the collaboration between, of course, the Ministry of Health, the Ministry of Mines, and then the Ministry of Labor?
Yeah, as I said, the three ministries each have got a mandate. In terms of the Ministry of Health and Social Services, we are talking about our mandate as a ministry for regulating issues related to occupational health and safety. That is our role. At the same time, we are also looking at our role as a ministry that is responsible for the provision of public health. Therefore, we are the facilities, the public health facilities run by the Ministry of Health and Social Services, provide services to people who are afflicted either by TB or by HIV or by occupational lung diseases. So that is our mandate. And we provide these services to those that are affected, to members of their families, and to the communities in general, because we also must know that TB will not necessarily only start in a mining setting. TB can also come from the community and enter a mining setting, infecting people there, and vice versa. So we, within our mandate, are responsible for making sure that, for example, there is appropriate screening for the people working in the mining sector, so that they are screened for the disease. We need to look at issues of managing the risk and the diagnosis of these people. We need to make sure as a ministry that we provide what is known as information, education, and communication material on TB, HIV, and occupational lung diseases. We need to look at issues of quality management of TB, HIV, and occupational lung diseases in the mining sector, and also for monitoring and evaluation of the interventions and the programs that are being implemented to protect the mine workers. So that is our mandate. On the side of the Ministry of Labor, the Ministry of Labor also has a mandate in terms of our commitments as a country to the recommendations from the International Labor Organization that seeks to promote the welfare of workers. So from that vantage point, the Ministry of Labor comes into play. And then on the side of the Ministry of Mines, Ministry of Mines and Energy is the ministry that regulates the mining activities, is the ministry that directly engages with the stakeholders like the mining companies, the stakeholders like the Chamber of Mines, for example, which represents the private mining industry. And it's also the same ministry that engages with the stakeholders such as the former miners, for example. So the whole ecosystem of the mining industry, vis-a-vis the roles of the ministries that sign the standard operating procedures, find that nexus, find that connection, find that space to work together. So that is why we are taking what we are saying is a whole of government approach, is a whole of society approach, because it's not only the ministries, but also the stakeholders, as I said, such as the Ex-Miners Association, is the Chamber of Mines, it's other community-based organizations that are involved in these activities, whose mandate or whose interest is to protect the well-being of the workers and also the ex-workers. For example, when we talk about medical screening and surveillance for mine workers, this surveillance takes place and is focused on those workers, farm workers, or other mine workers who are working for the mines at any given time. But once that person leaves the employment, then there is no follow-up. They are no longer screened. But imagine that if this person is infected, for example, with TB, then they will go out and they will be suffering all on their own. So we want to have a feedback loop that allows for these mine workers to also be able to be screened, to be taken care of, to be treated when necessary. We need to have follow-up mechanisms to follow these mine workers up and also their family members, because TB is a contagious disease. So if their family members pick up TB, we should be able to give them to screen them first, to initiate them on treatment, and to ensure that they remain on treatment and they finish their treatment courses and to be cured. Because we know that TB is preventable, TB is curable. And if, for example, they get co-infected with HIV, again, we as the Ministry of Health and Social Services that is responsible for issues of public health, we will make sure that those that are infected with HIV are tested and they know their status, they are initiated on treatment, they remain on treatment, and we, again, to make sure that they are virally suppressed. so that they are not able to pass on the HIV infection to other individuals.
Mr. Nangombe, as always, it's such a pleasure having you with us. Thank you so much for joining us this evening. Just your brief and final remarks.
Thank you, Nina, for reaching out. We just want to say that as a government, our best interest is the interest of the people of Namibia. Our interest and our uppermost consideration is the consideration of making sure that we strengthen our public health system. So these standard operating procedures are aimed at doing just that, so that we address the issues of risk management, information, communication, and education, quality management, monitoring and evaluation of the issues related to the interventions against TB, HIV, and occupational lung diseases in the mining sector, because we need to make sure that the workers are healthy, otherwise the industry is not doing what it ought to do to help our country develop.
Indeed so. Well, thank you so much for your time and have a great evening.
Thank you, Nina. I appreciate it.
That was Executive Director in the Ministry of Health, Nangombe, speaking to us on the line. We'll be right back after this.